Welcome back to another episode of the Kinky Wellness Podcast. In today's episode, I'm thrilled to welcome award-winning urologist and author of the 21st Century Man Advice from 50 Top Doctors, Dr. Judson Brandeis. With over 25 years of experience, Dr. Judson is here to break down why penis pumps aren't just for vanity reasons, why fillers only go so far, the journey and challenges of his P-Long study, the importance of PRP and nitric oxide, and to answer the age-old question, can men really grow their penis length and girth naturally? We're going to have to see. So without further ado, let's welcome Dr. Judson to the show. Hello, Dr. Judson. Welcome to the show. How are you doing today?
Oh, I'm doing great. Thanks for having me on. I appreciate it.
Well, I'm excited to have you on the show because we're talking about elongating our penis size and just penis size in general. And I know that this can be a pretty personal topic for most men. It's something that they might be weary of depending on what type of influences they have. So just to get us started, why don't you let us know a little bit about you and kind of how you got into this field?
Boy, it's been a long journey. I went to Brown University for undergraduate, and then I went to Vanderbilt for medical school. During medical school, I did a year of Howard Hughes Medical Institute sponsored research at Harvard Medical School on kidney transplantation, which is what led me to surgery and urology. And then in urology training at UCLA, I became really interested in prostate cancer and outcomes research. I did a year of outcomes research at UCLA, and then went into private practice in Walnut Creek, California, up in Northern California. Built a robotic surgery center, built a kidney stone center, built an MRI-guided prostate biopsy center. And then I became really interested in regenerative treatments in urology. So basically helping men achieve erections at a point in their life when they're no longer able to. And it helped pioneer low intensity shockwave therapy for erectile dysfunction and PRP. And I would see a lot of men who'd come in because I'm a surgeon and a urologist and an expert in sexual medicine who had tried penile enhancement or elongation procedures and ended up with total disasters. And I thought, well, there's got to be a better way to do this. And so I created the P-Long study, which is a protocol that I created to increase the length, girth, and function of a healthy guy's penis. And I got it IRB approved. That's where the Institutional Review Board comes and reviews your study. I had it listed by clinicaltrials.gov, which is the NIH clinical trials website. And then I presented the findings at the International Society of Sexual Medicine and the Sexual Medicine Society of North America, and then finally published in Andrology, which is a reviewed journal, which is basically in a nutshell to say that, I'm qualified to actually do research, and I had my research vetted by the professionals in the field. And we were able to show that you can increase the length of a healthy man's penis almost an inch, the girth by about a half inch, and you can improve the function. And this takes about 6 months.
Wow. So that's actually a lot because when I first look at this or when I first hear about this, it can be scary with like surgeries and complications that can come out of this. So, what makes yours different in the sense of the holistic way that you've done this?
Right. So, a lot of the technologies that exist involve using foreign bodies, whether it's fillers or silicone or cutting a suspensory ligament. And what I put together was a way to increase the length, girth, and function by naturally stretching the penis with a device called the Restorex, which was developed by a friend of mine at the Mayo Clinic, and by a penis pump developed by Dr. Joel Kaplan, and then using PRP in the penis, which is platelet-rich plasma. So the platelets in our body have two functions. One function is to cause a clot, to stop bleeding, but the other function is to cause tissue regrowth, right? So when you cut yourself or you get injured, you want to stop the bleeding, but then you also want to start the regrowth process, and that's what PRP does. And then also a nitric oxide boosting supplement that I created called Affirm. And what this does is it dramatically improves circulation to the penis.
Wow. And in the terms of PRP, now that sounds like if you were taking something like that, it would help you in other avenues of your life in the same way? Or is this
Yeah.
really specific?
So PRP is a very non-specific way to increase growth. So PRP is used in hair growth, it's used in dental surgery, it's used in orthopedics, anywhere in the body where you need to accelerate the growth process. And then a friend of mine, Charles Runnels, actually developed a way to use this in the penis called the P shot, and in the clitoris for women called the O shot. And then for the purposes of the P long study, I modified the P shot in a way and developed a technique using a single injection under ultrasound guidance that we could deliver the PRP to the penis.
Now, when it comes to your P long study, was there anything that really jumped out of you when you were reviewing your findings?
Well, the amazing thing is we got length, girth, and function, right?
Mm.
So, there's no real way to assess an improvement in function in men who already have normal erections. But a guy knows, like if things are working better than they used to, they'll look you in the eye and tell you. And since I treated all of the 30 patients in the study and did all 6 of their injections, you know, I had these guys look me in the eye and tell me, like, listen, things are working better. I'm longer, I'm thicker, and my partner's happier.
Wow. Now, when it comes to this, does this work on all types of men or anyone even with Peyronie's disease, or is that somebody they wouldn't be able to do this?
So the people that we had in the study were men who had, normal penile function. So we excluded men who had had previous enhancement procedures. We excluded men with Peyronie's disease. We excluded men with erectile dysfunction. And so really we were only looking at men with normal erectile function. Now, I used the P-long protocol in men with Peyronie's disease to help them increase length? Yeah, I have, and it does work. In addition to treating the scar tissue that's causing the Peyronie's disease, but specifically we looked at younger, healthier men with no erectile dysfunction, and so that's really the only group that I can definitively comment on.
Mm,
I mean, that's
absolutely.
the thing is, in sexual medicine, there's so many people that are out there making false and ridiculous claims that are totally unsubstantiated. And so, and you can do that because a lot of people aren't going to call you up or go out on social media and say, listen, I tried this penile enhancement protocol because my penis is short and it didn't work for me.
Mm,
That's not something that a lot of people are going to go out and talk about. And so there is the potential for a lot of abuse by marketers and people that want to make those claims. That's the difference really in the P-long study is that uh, I did this study sort of in the public eye, and I had, my colleagues that are mostly academic colleagues look at it, accept the study, publish the study, and then, we have a network of 50 or 60 providers around the country that are providing this service to uh, their patients and are getting similar results to what we got in my office.
mm. Now, there's a lot of reasons why men would come to you with this type of issue, but do you see that there's recurring themes that come up or influences, whether it's from social media or pornography?
Yeah, it's surprising that the distribution of penile size in the study was kind of all over the place. Guys with small penises, medium penises, and large penises. And, that's the same thing with breast implants, right? So there's 300,000 women each year in the United States that get breast implants, but not all of them have breast cancer. Some women just want to have bigger breasts. I mean, some guys just want to have bigger penises. When they actually do studies and ask men, like, do you want a bigger penis? 50% of men say that they want a bigger penis, and probably 50% of men are lying.
Yeah. Well, even with breast implants, like those, I believe that you have to get them done every few years. Now, with this procedure, would you have to come back in the future to do this again, or are these long term results?
As long as you get good erections, and especially good erections at night when you're sleeping, there's no reason that the size of the penis is going to shrink, right? So, in a young healthy man, you should be getting 30 to 60 minutes of erections every night when you're asleep. That's what maintains penile health. And so as long as you're getting those erections, so when I see patients in their 60s, 70s, 80s who are no longer getting good erections, those guys' penises shrink.
Mm.
And so those are the men that I recommend using a penis pump to get the tissue back to the elasticity and the size that it used to be. But in younger, healthier people, if you're getting 30 to 60 minutes of erections every night, especially if you take something like the Affirm Nitric Oxide booster before you go to sleep to improve circulation, you should be able to maintain the gains that you got in the P-Log study.
Mm. Now, I feel like that's might be a little bit of a misconception in the sense that penis pumps are really just for vanity or like how someone looks, but really it sounds like there's actually some health benefits to using it as you get older.
Oh yeah, I mean they're very functional for my patients. For my patients who are not getting nighttime erections. And think about it this way. In the flaccid penis, when I do ultrasounds of the flaccid penis, I can see what's called the internal pudendal artery, which is the artery that branches off the internal iliac artery that goes to the penis. And you can see pulsations, arterial pulsations, to the point where it gets to what's called the deep cavernosal artery, which is the artery that goes into the middle of the corpora cavernosa, which are the erectile bodies. And the arterial pulsation stops, right? So in a flaccid penis, the vascular tone is tight, which is why you're not getting good blood flow into the penis intentionally during the day or situations where you're not supposed to get an erection, right? And so
Mm.
because of that, you're not getting oxygen, you're not getting nutrients, or at least, not to a large degree. And so the penis isn't getting what it needs to maintain healthiness. But when you go to sleep at night, every time you enter REM sleep, which is where you enter dream sleep, you should be getting an erection. And so on average, healthy men should be getting 30 to 60 minutes of erections every night. And if you want to check if you're getting erections at night, there's a device called the FirmTech device. And you can go on the FirmTech website or the affirmscience.com website and pick up a FirmTech, and it will actually, you put it around your penis before you go to sleep, and it records the pressures in the penis. So the higher the pressure, you're getting an erection, and then you can Bluetooth it to your uh, iPhone or cell phone.
Oh, and is that pretty accessible? Like anyone can buy that if they go
Yeah,
online?
yeah, yeah,
Oh, well,
absolutely.
wonderful.
Yeah,
So,
it's a pretty cool gizmo.
yeah, actually, I was going to
It's kind
say,
of like
so
your Fitbit for your penis.
yeah. Well, in addition to these type of devices, what other are common alternatives that people can turn to that can provide some serious consequences if it's not done right?
Yeah. So, a popular method is use of fillers. So the
Hmm.
same fillers that, movie stars use for their lips or their face, you can inject into the penis. So basically below the skin and above the erectile bodies. The problem is that gives you girth, but it doesn't give you length and it doesn't increase the size of the head of the penis. So this is what I call a pig in a blanket penis, right? And pig in a blanket is great in cocktail parties, but it's not great in the bedroom.
Yeah.
And the other problem is those fillers are very expensive. So people pay 10,000 bucks up front to get these fillers. And then over time, those fillers dissolve. And so every 2, 3 years, you're going to have to spend another 3,000 bucks to get new fillers placed in the penis.
And I'm not sure if this is relevant, if it's a different type of fillers, but I did see a study that came out with women putting fillers, like as it dissolves, it moves to other areas of the face. And I was wondering if that also can happen for penis as well.
Yeah. So if you look at the face, there are basically little packets of fat in the face that are covered with fascia. And so what they found is that over time, the fillers basically go to the bottom of those little packets of fat, and it makes the face look really saggy. Now, in the penis, the fillers will clump in different areas, and so you end up with kind of a lumpy, bumpy penis, which probably not
Mm.
ideal.
I'm not sure what's in them, and I'm not sure if they're all going to be healthy or react well to everybody's body. So it is something to consider when going down that avenue, I think.
Yeah, I mean, there are different types of fillers. So there's collagen, there's hyaluronic acid, there's PMMA. PMMA is kind of like a thicker, like putty type filler that's
Mhm.
less likely to dissipate, but it feels kind of like harder, like a putty. Hyaluronic acid feels more natural, but the problem is it feels more natural because it has a higher water content. And because it has a higher water content, that water will basically dissipate. And so the filler is going to dissipate.
Hmm. So,
So,
as you've created this journey, what challenges have you had to overcome in the sense with coming to this?
oh God, this was quite a journey, especially since we did most of the study during COVID. So first of all, it's hard to recruit patients for a study like this. It's not like where we have a new treatment for cancer where you can go out on Google or Facebook and ask people for participants, or even go to a clinical research company that is able to get patients for studies. So I started out by putting, well, we advertised it on clinicaltrials.gov, the NIH website, but then we went to gay newspapers in San Francisco, got a few patients, and then I'm a sexual wellness advisor for Pornhub, and so we started doing some advertising on Pornhub. We got a couple more patients, and then we um, we advertised on some swingers websites, and finally we contacted Rena Malik, and she put it in her community portal on YouTube, and we were able to kind of collect enough patients to show statistical significance. So just getting patients to participate was kind of a challenge. And then, it clinical research is tough, getting patients to come in, getting consistent data, getting consistent measurements. There's a lot that goes into good clinical research to get it to the point where you actually can make a conclusion that has some validity.
And with your success stories, were all of them successful when they came out of the clinical trial?
Yeah, I mean, everyone grew. Some grew less, some grew more. So, I had guys grow a half an inch. I had one guy grow an inch and a half. Um, so it worked out to about 15% of your original length. But then we subfractionated it by length over 5.4 inches and under 5.4 inches. So the guys that had length under 5.4 inches grew about 20%, and the guys who were over 5.4 inches grew about 10%.
Oh, wow. That's very wonderful.
Yeah.
And so with these patients, do they come back to you for checkups after? Like, what would be the process of someone if they wanted to go through this, and what would they typically expect from you?
Yeah. So, I mean, if there's someone out there that's interested, and I think it's really important, first of all, that I say up front that I'm not telling anyone to get a bigger penis, right? That's between you and your maker,
Mm.
right? Like, as long as you can urinate and procreate, your penis length is perfectly fine, right? But if it's something that's important to you, then P-Long will help you do that in a way that's safe and effective and natural, right? And so then you would go to p-long.com, find a provider in your area, and there's tons of information on that website, including the scientific papers and including scientific presentations. So, my goal is to give people as much information as I possibly can about what P-Long actually is and what the benefits are and what the downsides are. And then find a local provider. And then what's involved is using a RestoreX device 20 minutes twice a day, using a penis pump 12 minutes twice a day. So it's about 35 minutes in the morning, 35 minutes in the evening, and then a PRP injection into the penis, which sounds really painful, but actually, if it's done properly, you hardly feel it.
Hmm.
And that's once a month for 6 months, and then taking the Affirm nitric oxide boosting supplement, 2 tablets twice a day. And the study ran for 6 months. Now, at the end of 6 months, your penis isn't going to magically stop growing. So I had a lot of my patients who were in this original study continue on in the office, continuing to get PRP injections, and they continue to grow. Right. So
Oh,
when you do a study, you have to stop it at some point. And when you get to a point where you show statistical significance, that's the right place to stop. But just because we stop the study doesn't mean that guys can't continue to come in and grow. So if you have a 5-inch penis and you want a 7-inch penis, you're going to have to go for a lot longer than 6 months. Maybe you'll go for 2 years, but there's no downside of going for 2 years. PRP is just using your own platelets that are concentrated and then activated and re-injected into the penis, and then stretching, traction, and a nitric oxide boosting supplement, which is totally healthy. So there's nothing in the P-Long protocol that you would need to stop after 6 months.
Well, you mentioned that there's really no side effects to this. So, how do you guarantee safety and effectiveness for people that want to pursue this?
Yeah. So, like I said, I treated all 30 patients personally that were in the study. So I would know if there were any negative side effects from anything that we've done. And then, we've gathered almost 100 additional P-Long patients in my office that I do all the injections on. So I would know if they were having any problems or side effects. And then I train all the P-Long providers around the country, and I'm not getting feedback that people are having problems from it. So, if anyone would get information on side effects or negative effects, it would be me.
Mm.
But that's consistent with the use of PRP. And PRP is a very low risk um, situation, and then use of penis pumps and traction devices, that's a very low risk. And then using it like the Affirm nitric oxide booster, we've had tens of thousands of people use nitric oxide, that particular nitric oxide boosters. But I mean, tens of millions of people have used nitric oxide boosters, really with tremendous benefit. It improves brain circulation and improves athletic performance through muscle circulation. It improves blood pressure. It improves perfusion of the penis. And, it's totally safe. There's no, I did a video where I took actually 10 Affirm tablets at one time just to show that it's totally safe.
Well, I was going to say, it sounds like they have additional benefits that would be further than just penis related things. And as you mentioned, like that's quite improving your brain function. That's fantastic.
Yeah, I mean, anything that will benefit from circulation is going to benefit from a nitric oxide booster, and it benefits women too. I mean, women need circulation, and women need genital circulation, brain circulation, muscular circulation. And it's actually really interesting. I did a clinical research study recently on using Affirm to boost nighttime erections. And so we used that FirmTech device, and we had patients for 2 days, don't take anything, use the FirmTech device, and then for 2 days take 2 Affirm tablets before they went to sleep, and use the FirmTech device. And we showed a 30% increase in the length of erections, not the size, but like how many minutes guys got erections, not actually in the number of erections or the number of times they got erections, but how long those erections lasted, which is, it's 30% improvement in penile blood flow at night when you're sleeping. It's really tremendous. And then the next study that we're doing right now, called the Confirm-2 study, is really actually fascinating. So the way that nitric oxide works is it increases what's called cyclic GMP. And the more cyclic GMP you have, the more you open up blood vessels. So the cyclic GMP creates a cascade of events that ends up opening up blood vessels, right? And the way that Viagra and Cialis work is they selectively block an enzyme called PDE5. And PDE5 is only in the penis. That's why these medications work so well. But if you're taking nitric oxide to increase cyclic GMP, and you're taking Viagra and Cialis to block the breakdown of cyclic GMP, theoretically, there should be a synergistic relationship between nitric oxide boosters and PDE5 inhibitors. So the study that we're doing is, for 2 days, we have guys taking 40 milligrams of sildenafil, which is generic Viagra. And then for 2 more days, we're having them take 40 milligrams of sildenafil and 2 Affirm tablets. And what we're finding is a dramatic increase in nighttime erectile function. And the reason we like nighttime erectile function is because it's not dependent on any relationship issue, right? So like if you and your partner had a tiff or a fight or whatever, like you're not going to be having sex that night probably, or maybe you're having makeup sex, but
Yeah.
but nighttime erections is purely a physiologic function. So regardless of whether you had a tiff with your partner or not, you're going to get nighttime erections if you're healthy and you have good penile blood flow. And so the massive importance of this study is that a lot of people can't take higher doses of Viagra and Cialis because of side effects, because they get headaches, facial flushing, visual changes, reflux, muscular pain, blocked sinuses. And so if you can take a nitric oxide booster, which is totally healthy and doesn't have any side effects, and take a lower dose of a PDE5 inhibitor like Viagra and Cialis, that's a tremendous benefit.
Well, I do have one question. So, nighttime erections, I feel like there's a lot of emphasis in considered with the morning wood. And I feel like are these two different, would they be two different things? Or when someone
No,
wakes
they're
up with an erection?
yeah, I mean they're pretty much the same. Let me see if I can. Okay, here, just to give you an example, right? So I don't know if you can see this enough, but like that is
So
my
we have
own
4
personal,
a.m. time and then
yeah. So
like
the
just
2
before
a.m.,
6.
4 a.m., 6 a.m., 2 a.m., 4 a.m., 6 a.m. So, if I woke up at 6 o'clock, I would wake up in sort of mid erection cycle.
Interesting. So you're supposed to get almost multiple, almost in a wave format?
Yeah, yeah. And then
Okay, cool.
the bottom is the next day when I took Viagra and a nitric oxide booster. So we had 1, 2, 3, 4, 5, 6, and in the middle of the sixth erection, I woke up.
Mm.
Right. So that would be sort of morning wood, and then then this last one is 1, 2, 3 good erections. Right. So that shows you that in me in an N of one, right? We don't do research uh, on just one single person, right? So we're going to try to get 20 or 30 folks to participate in this follow-up study. But in my own individual experience, you can see by taking a firm with Viagra, 40 milligrams of Viagra, the nighttime erections were very significantly improved.
Now, I've heard some people say to have Viagra long term isn't really that healthy, but is there some benefits to using it sometimes, for instance, for something like this?
Yeah, I mean, that class of medication is actually uh, a miraculous drug, right? It's been shown to improve erectile function. It's been shown to improve urinary function. It's been shown to reduce the risk of dementia,
Oh,
mostly
wow.
through a circulation-based effect. And it's been shown to reduce the risk of heart disease or heart-related events. And that's mostly also to due to increasing circulation. So really, it's a super healthy drug. Hundreds of millions of men have taken it. The side effect profile is very, very safe. Some people get facial flushing or headaches, but that's not dangerous per se. It's just uncomfortable. Some people get some reflux because it relaxes the smooth muscle of the esophageal sphincter. Some people get stuffy nose because it constricts. Opens up blood vessels in the nose. So, you can get some minor annoying side effects, but it's extraordinarily rare for people to get. There's a form of visual disturbance or blindness that you can get, but that's, 1 in 10 million.
Now, is there anything that you really want men to know when it comes to their penis size or if they're thinking of doing an enlargement process like this, something that often gets overlooked?
Well, I think, and you'll probably answer this question better than I can, is that women are looking more for confidence than
Mm.
for penile size, right? So if you went to bed with a guy and you felt a kind of big silicone implant or some lumpy filler in the penis, how would you really feel about that? And how would you feel about this guy that was so insecure that they would squirt a bunch of filler or have a surgery to put a silicone implant into the penis? Um,
Well, a
you know,
lot of
I
the
mean,
people that I talk to, they're men that have suffered complications from circumcisions that have happened when they were younger. And now the scarring tissue is getting in the way, or I've heard of even ripping during when they were going through their teenage years and things like this.
yeah, but circumcision really deals with the skin tissue.
Mm-hmm.
And penile size deals with the size of the erectile bodies that are on the inside of the penis. And so that's the challenge, is increasing the size of the erectile bodies. And so, what we're really dealing with is self-confidence issues where guys watch pornography and say, well, I'm not that size. I need to be that size to please a woman, which obviously, if you know anything about sex, you really don't need to be a certain size to please a woman. There's lots and lots of different ways to please a woman. And so, or someone got a comment in the locker room when they were in seventh grade or eighth grade or ninth grade, and they've been insecure about that. Or I've heard guys tell me that, like a girlfriend or something like that would say to them, "Oh, you weren't as big as my last boyfriend, and he was so much better in bed than you were." So, those kind of psychological things really plague people and or men and drive them to increase the length, girth, and function of their penis. And you know, I'm not a psychologist. That's not something that I deal with, but I am a urologist and a sexual medicine expert, and I want guys, if they're going to pursue something like this, to be able to do it in a way that's healthy and safe and effective. They're not buying, something in the drugstore, or the gas station uh, that promises something that they can't get delivered.
Absolutely. Well, you've been very informative about your new technology that you brought on. And do you have any final thoughts that you wanted to say?
Yeah, I mean, I think it's important to understand that you should try to be happy with what you have. But if you're not happy with what you have, there's a safe and effective way to increase the length, girth, and function of the penis. And also, uh, I'll put in a plug for my Affirm Nitric Oxide Boosting Supplement, which is, another one of those things with really no downsides and a lot of upsides in terms of boosting circulation for brain function, for muscular function, uh, for genital circulation, and even for blood pressure. I get a lot of my patients off their blood pressure medications by putting them on nitric oxide boosters. And people ask me, like, well, how come drug companies won't create a product using nitric oxide booster? And the problem is that there's really no financial upside for them to do that, right? So they do a massive study costing tens of millions of dollars to show that nitric oxide boosting improves blood pressure and circulation. And then, you know, anyone out there can create a nitric oxide boosting supplement to compete against the one that the drug companies created. So that's why you don't really hear much about nitric oxide boosting. But the thing is, when I was at UCLA, one of my professors, Louis Ignoro, won the Nobel Prize for discovering nitric oxide as a second messenger. And then he and another one of my professors, Jake Rafer, actually wrote the paper that described the mechanism of action of Viagra. So nitric oxide boosting is super legitimate.
Well, I'm just learning a little bit of nitric oxide in the sense that I'm studying fascia right now, and the when you massage your fascia and you work on it, it can increase your nitric oxide as well. And so I was quite interested in that.
Yeah, I mean it's in the scientific community, it's ubiquitous. Even in COVID, um, there was a study really early in COVID. Mass General Hospital had 10 pregnant women. They didn't know what to do with. They got COVID, and this was before the vaccine and before Paxlovid and any of those things. And they put them on inhaled nitric oxide, and all 10 of these women got better, right?
Oh,
Because
wow.
the inhaled nitric oxide opens up blood vessels. And what COVID did is they created an inflammation in blood vessels and closed those blood vessels down and led to clotting and blockages of those blood vessels. So by taking inhaled nitric oxide, they opened up those blood vessels, and all
Wow.
those women did well.
That's fantastic. Thank you for
Yeah.
sharing that.
Yeah. Yeah.
Wow. Well, where can my listeners find you if they want to reach out or learn more about anything that you have?
Yeah. So you can go to p-long.com if you're interested in penile enhancement. You can go to Affirm Science, AFFIRM Science.com if you're interested in the Affirm Nitric Oxide Boosting Supplement. I also have a best in class supplement for boosting testosterone called Support, one called Prelong for premature ejaculation, and one called Spunk for prostate health. And then I wrote the most comprehensive and medically accurate men's health book ever written called The 21st Century Man. So you can go to the 21stcenturyman.com, all written out in letters. or you can go to Affirm Science and purchase that book. But if you go to the 21stcenturyman.com, you can read passages from the book and learn a little bit more about the book. And then if you're interested, I practice in Northern California. So you can go to Brandeis MD, BRANDEISMD.com, and make arrangements to see me in person. Or I do second opinions around the country. So I'll do, telehealth stuff. And then I have a YouTube channel where I post, I think I've got 100 videos or something like that up there.
Well, I will make sure to put all your links in the description so everyone can get
I'm not hard to find.
Yeah. Well, wonderful. Thank you so much for coming on the show, and I hope you have a great rest of your week.
Awesome. Thank you so much for having me on. I appreciate it.
Thank you. And for my listeners, you guys know what to do. As always, stay kinky.